Are we now accepting that rapid weight loss is safe? One of today's questions and many more. Hi, I'm Dr. Meghan. I'm an obesity medicine physician and weight loss coach here to help you cut through the pseudoscience and confusion in weight care. My approach combines evidence-based medicine with real behavioral change, so you don't just take medications, you actually transform your health. Stick around for clear, medically based answers to your weight questions. Welcome to Office Hours. A few details before we get started. As a caveat, I can't answer personal medical questions because I'm not your personal medical doctor. So if your question does lean a little personal, I'm going to change it slightly so it's more broadly educationally applicable. Also, if you're curious as to how weight loss coaching can help you take your results to the next level, especially if you're on a GLP-1 already, I will leave that info down below on how you can get in touch with me and we can talk more. But let's get started on today's questions. First question, I'm on gabapentin. Does this mean I'm not going to lose weight? What a great question. So gabapentin is one of the one of the usual suspects, I would say, in terms of medication-induced weight gain. So it can be one of those things that people are on for a long time. They see the weight coming on, or they're on a low dose and they bump up the dose and all of a sudden they realize they have gained weight. Some people don't gain any weight on gabapentin. I've seen that too. I have patients on really high doses that their sleep medicine doctor has them on and they haven't gained weight at all. So it really depends on the person. But if I have a patient who's on gabapentin, and they are struggling to get their weight down, I love using a GLP-1 because I feel like I can finally fight fire with fire, especially for people who are on a weight promoting medication and they're doing all the things that they want to be doing and the weight is just not coming off. These medications can be really good tools to help get their weight loss lower. Now, for some people, and it depends on the patient, it depends on the dose, it depends on what's going on with them, they may not get as much of a weight loss as somebody else who's not on a weight promoting medication, but they might. It's hard to say. It's definitely something that I will look out for, but I certainly wouldn't think that if I have a patient on gabapentin and I start them on a GLP-1 that they wouldn't lose weight. They might not lose weight at the lowest doses, but usually for my patients, they do lose weight. How much weight they do lose is very individualized, but if I have a patient on gabapentin, I wouldn't say, don't even bother. No, not at all. They can definitely, for me, if it's the right person, they can definitely still use a GLP-1 medication. And in fact, I think it's usually a great idea for the right person. All right, next question. Here's what I don't understand. We've been warned for decades that it is not safe to lose weight fast. However, these drugs make eating so challenging and undesirable that these drugs put a person in an extreme calorie deficit, resulting in rapid weight loss. Am I wrong about that? Is this the main effect of the drug, or is there another mechanism of action? Are we now accepting that rapid weight loss is safe? This is a great question. So, I think it also depends on how a person is losing weight and if they're under medical supervision. These are all really important caveats in terms of weight loss. But number one, I would say the question is the calorie deficit the main mechanism of action? It is one mechanism of action, but it's not everything. So people generally do eat less on the GLP-1 medications because they feel a lot fuller, a lot faster, because there's getting stronger signals from their stomach that they're full, and they can actually hear those in a way that they maybe couldn't hear them before. So it is very effective in reducing the amount of food that people are eating. However, the GLP-1 medications also work by how we think part of the reason that they are also so effective is they seem to adjust the storage, the fat burning and fat storage balance in the brain to make it easier to lose some weight. And so that is another reason why they're so effective. And they're not only working on the GI tract, but they are working in the brain to help adjust that balance of fat storage. And then thirdly, they also really help for some people with food cravings so that they don't even really think about eating foods that they might have really felt drawn to before, like chips, cookies, all these foods that cause them a lot of cravings. They just aren't really that interested in them anymore. So they work in several different ways. Reduced food intake is one of them, but it's definitely not the only mechanism. So great question. Number 2, are we now accepting that rapid weight loss is safe? This is a very good question because there are times in which we do, and of course it depends on the situation, but I don't do this, but there are some doctors that have people on very low calorie diets, like those meal replacement shakes. People will lose weight quite rapidly on that. Bariatric surgery, people lose weight pretty rapidly when they undergo that. And then people can lose weight pretty rapidly on the GLP-1 medication. Again, I think the really important point is that in all these situations that somebody is monitored, so we can also make sure that they're not getting malnourished, because obviously we don't want that to happen. Of course, there are other things that can come up when someone loses weight loss rapidly. Gallstones and the resulting complications from that can occur. Your skin doesn't usually like it when you lose weight quickly. But also there is some research now that suggests that when people do lose weight more rapidly, it's more motivating, it's more helpful for them in terms of their weight goals. For me, it is never something that I am striving towards. I think, a pound, 2 pounds a week is great. It really depends on the person. It depends on how they're tolerating the medication. If somebody's losing weight quickly, but they're also not having any quality of life issues and they're eating what we feel like is an appropriate amount, but some people just lose a lot of weight and they're just kind of living their life and going about their daily business. And, that's a very different situation than somebody who's losing a lot of weight and they're not really eating and they're having a lot of nausea or vomiting or other gastrointestinal issues. Like, the quality of life portion of that is also extremely important. And so, yes, there is some literature to say actually now we think rapid weight loss is helpful for long-term results. Sometimes people, that's never something that I want to push for people because it can be very uncomfortable, and some people it's just not going to happen that way. So I just think my approach is really like, let's see what the medication does. Let's make sure you're getting through this safely at a pace that is appropriate and that you're comfortable with. And I always tell patients, at the end of the day, you are not going to care. In 5 years, you're not going to care if you lost, 20% of your body weight in 6 months, 12 months, 24 months. You won't care. The only thing you will care about is if you got there in a way that was comfortable and you could stay on the medication and you weren't hating your life. So quality of life, I think, is really important and probably not something that we talk about enough. But if people are miserable, they will not stay on the medication with good reason. So I think, and a lot of times these medications need a little bit of time for people to get used to it. So if somebody is really, really miserable, it's easy to see why they wouldn't continue that. So I think that's a great question, and it kind of fits into a broader perspective of what's going on with the patient, over their weight loss journey with the medication. So thank you so much for asking that. Next question. Let's see, this one is a little long, so I'm going to shorten it so it's a little briefer. Basically, this person began using compounded tirzepatide. First they started walking, low calorie diet, lost 33 pounds. Then they started using compounded tirzepatide, lost an additional 28 pounds. They're currently at 160, goal is 135. However, I've noticed that most of the weight loss has occurred in the lower part of my body, while my upper body has not slimmed down significantly or weight or clothing size. I currently wear an extra large. Given that I still have 25 pounds to lose, I would like to know whether it is likely that my upper body will begin to decrease in size and whether it is realistic for me to reach at least a medium size. Despite having lost a total of 63 pounds, the change is not very noticeable, which has already been observed by my family and friends. I would appreciate your guidance regarding this concern. Okay, well, first of all, congratulations on all your hard work. It sounds like you are doing everything that you can to get yourself to be as healthy as you can be. And whether people notice or not, you know, and your body knows. So I think you should give yourself a big gold star for that. Congratulations. Also, just as a caveat, I will say sizes are very, as you probably know, they're kind of all over the map. And a medium in one brand is going to be a small in one and a large in another and yada, yada, yada. So sizing, well, I think it is helpful. I always love to use how clothing fits as a good measure of how somebody's weight loss journey is going, because I think it's a nice holistic measurement. But also, if you're going by clothing sizes themselves, I would try to stick to one brand in particular just for some consistency, but there is some variability, of course. So anyway, congrats on all your hard work. And I would say, this is sometimes a frustrating thing for people, is that you can't really lose weight. Now, there's a very tiny body of evidence that suggests maybe intermittent fasting helps with visceral fat, that fat deep in the abdomen, but that's not, I only tell people to intermittent fast if they naturally feel inclined to do so. I would never want a patient to do that just because. But in general, you can't really lose fat, which can be very frustrating for people. I always, if people can switch to the FDA approved version of their tirzepatide or their semaglutide, I always prefer them to do that, just because you just don't know what's in the compounded medications, and not just in terms of safety, but also in terms of efficacy. So would you be getting a stronger effect with the FDA approved version? We don't know. So if people can, that's always something, for many reasons, that I encourage them to do. Also, if people have a lot of weight around the middle and it's not moving, for these patients, I always think it's a good idea for them to check in with their physician, because there are some medical conditions that can have more what we call truncal obesity, or weight around the middle. So Cushing syndrome, hypothyroidism, things like that. So I would definitely want a patient who is noticing that to check in with me, so we can make sure that there's nothing else going on behind the scenes. And then finally, when people are not happy with kind of where the weight is, I think it's helpful to get really specific about the weight. So if is it weight around the middle that you can pinch, so we know it's more subcutaneous fat? Is it weight that, you feel like your abdomen is kind of like a tight drum and there's not a lot of subcutaneous fat, but it feels deeper. It's kind of like filling out the stomach, and then, or the trunk, and then that's probably more visceral fats kind of behind the abdominal wall. Also, for a lot of women, they carry weight in their breasts, and that can be the last place that they're going to lose weight. And so depending on where the weight is that is bothering somebody, that they feel like is preventing them from getting to their healthiest BMI, something like a breast reduction may be also something that they want to look into as an option. So where is the fat that's bothering you is very helpful in terms of regions, and then what the options are available. Next question is about liraglutide. Is it better to take it on an empty stomach or after you eat? Now, liraglutide being Saxenda or Victoza, and liraglutide is a daily injection. The nice thing about liraglutide is, like semaglutide or tirzepatide, it really doesn't matter when you take it time of day or when you take it with regards to when you're eating. Now, that being said, every once in a while somebody is going to notice a difference. So If you feel like you're sensing there is a difference, you can do some research on yourself, do a controlled experiment, take it consistently at one time of the day every day, either before meals or on an empty stomach, and record your data on yourself and see if it makes a difference. But in theory, it really shouldn't. Although, of course, for individual patients, your mileage may vary. These are great questions. If you have a question, these questions come from the community. So if you have a question, leave it in the comment section down below and I will add it to the list. Also, like I said earlier, if you are really struggling to get the most out of your GLP-1 medication, if you feel like you're really struggling in terms of how you're eating or how you're exercising, it's really just not working together to help you get the results that you want, I will leave my website information down below. Click on that link, schedule a consult with me. I will tell you how I help people all the time with this. I do this all day, every day. You cannot surprise me. And I love to talk about it. And I would love to help you if this is something that you are struggling with. So I'll leave that info down below. Thank you so much for watching and please be well.